for the warm welcome. And welcome everybody. It's kind of nice actually that the group isn't so big, it's a little bit less intimidating. So I've been asked to have a chat, I guess, in regards to failure, and that's why this is called the F word. It's like we don't like to acknowledge that failure is something that may be possible in our lives. So I'm just going to talk a little bit about myself, about what is failure, what is success, and just get your minds kind of ticking about why you're doing what you're doing, how you may be able to define what you want to do in your lives, and how to be happy and successful. Does this not? Okay. So, actually, yeah. So, my first question to yourselves to have a think about is exactly who are you? What is it that defines you? Are you someone's daughter? Are you someone's partner? Are you a medical student? Do you think that you're going to grow up to be some specialist doctor? What is your identity? How do you define yourself? And the reason why I'm asking you this question is because I had to go through this process myself. Although I've done my training in ophthalmology and I pretty much did all my years minus my fellowship, I reached a point where I hit a hurdle with my last written examination, and I really had to justify to myself why I'm going to lock myself up for another 6 to 12 months to sit that exam again. And what was it really that I was trying to achieve out of my job? Why is it so important to my identity that I am called an ophthalmologist? And I had to go through this process, and let me tell you, when you take away someone's identity the way that they've defined it, you fall in a heap. So let's say you get divorced and you've always been known to be someone's wife, or let's say you've always thought of yourself as a doctor and suddenly you're not a doctor anymore. What are you? It's really confronting. So I strongly urge you to actually have a think about who you are. And then just have a think about what are your goals in your life? What is your purpose? So what if you're a doctor? Then what? Why are you doing it? Why is it important? I personally had a goal of getting involved in third world medicine. That was why I thought I wanted to do ophthalmology. Not because of the money, not because of the fact that it was such a prestigious thing to get into, because they only took 2 people in the state to get into. I genuinely wanted to actually take that role of my skills and knowledge and give it to those who I thought would benefit from it most. So yeah, just some food for thought about yourselves. Why is this so important? Whether you like it or not, you guys are in a cohort where you are going to have more mental health problems than every other profession and compared to the Australian population. And the mental health survey that came out of Beyond Blue actually showed us these results. I don't know how well that's portraying, but essentially what that first graph is showing is that 1 out of 5 of you are going to have a diagnosis of depression and anxiety at some point of your careers. And that's significantly higher than the Australian population and other professionals. In addition, 1 out of 4 are going to have thoughts of suicide. That's pretty high, you know, to actually think that you're going to reach a point where you want to commit suicide. 2% have attempted suicide. Again, these numbers are significantly higher than the Australian population and other professionals. What got me so passionate about doing something about this and doing my research? One of the reasons was when I first came to Victoria, I found out that within 6 months we had 4 young doctors in training who committed suicide within 6 months. That is ridiculous. It was like an epidemic. So whether you like it or not, you're going to face these issues as realities, and you need to be aware. And I sort of wish that someone talked about that elephant in the room whilst I was a medical student. The sort of things that they teach you, you're going to become a doctor, and you know, the things are going to be amazing, and when you're an intern, at least you don't have to study anymore. They don't tell you about necessarily the realities of what might make you break. Some of you may be absolutely fine, and you'll be resilient, you'll think, what the hell is she talking about when you reach that point? But according to those statistics, a lot of you aren't going to be. So in case that's going to be you, you need to be self-aware and think about these things, and how are you going to manage your life and your career so you don't end up being one of these people in statistics. So which brings me to the realities of actually being a doctor. Next year, well, I don't know what year you guys are in, but your internship, I don't know how different it is compared to my cohort. I'm a PGY in Devon now, but I can tell you it was the worst year of my career. It was absolutely awful. It was a shock that, oh my God, is this what I got myself into? At $20 an hour, you know, I'm manually disimpacting people, I'm someone's secretary, and then when it really does count and you're going to be the one who's on call or on cover, you're out there on your own without proper supervision, and it's like you do 16-hour shifts, you work 6 days a week, you'll forget who your friends are, your partners will get angry at you, and then you'll face the reality of getting into training. Good luck, because unfortunately, your generation is that generation where there's too many medical students now, so it's going to be more competitive. You're going to face some serious stresses out there, and you need to be prepared that, what if I don't get on? Is that a reflection of you? Is that a reflection of the system? Is the system transparent enough for you to actually realise what's going on? So these are all realities that you need to think about. Then come exams, and my own research and studies have shown it's one of the most stressful times you're ever going to face. So you haven't even kind of reached that point yet of what may make you crack. But let me tell you, when you're working full-time, you're on call, and you're studying for exams, you can be one really nasty person to be around, including to yourself. So you need to be self-aware through this process before you reach that point. And then you might think that once you've passed those exams, this is awesome, I'm now a consultant. Actually, you're going to face what a lot of us face, and that is, oh, I don't have stress anymore, my life's supposed to be normal, my hours after hours are mine, and I don't know what normality is. What is normality? I don't know how to fill out my time. And then suddenly you're in this position where you have to deal with, how do I now become a normal person, potentially at the age of, in your mid-30s or maybe more. And then you become a consultant and you're struggling to potentially open up your own practice. It's competitive out there. I've got friends who have finished ophthalmology, and some of them in reality are actually a bit depressed, because they're like, I have to travel 40 kilometres between my practices, and now I'm in a position where I've worked so hard all of my life, and I'm actually earning less than you are as a registrar to start off my business. So these are the harsh realities that you're not told and we don't talk about. Work-life balance, I don't know, I really hope you find a way of having that, because that is critical to your psychological well-being. And then you start thinking about, well, when do I have kids? As a woman, it's hard. You're in training, you want to become a mother, you're pregnant, you're working like what I just said you are, you might be sitting exams, and your children might not see you as a parent. So, yeah, these are all things that are harsh realities that you need to come up with some coping strategies. So I'm sorry that I've kind of done that, but that's okay. We're going to come up with some strategies, hopefully. So this is another real issue that you need to be aware of, like bullying and harassment. That was one of the factors that played a role in the doctors committing suicide. It's a harsh reality. We are a nasty profession, and the survey results say so, that 1 out of 2 amongst the surgical trainees were actually facing discrimination or bullying and harassment, and these results have been replicated across the AMA with the different states, and it's not just in surgery, it's across every profession. So it is a rife problem. We're trying to do something about it, and your generation will be the generation that will stand up against this and not tolerate it, hopefully, and try and drive some of that change. And how do you do that? You do that by being self-aware. Don't turn out to be like one of those idiots who's inflicting this. But the only way you're not going to be is if you're self-aware. And you're going to go, I'm not going to turn out to be like you. You know, so and let me tell you, when I was doing surgical training and someone was saying stupid things like, woman, are you blind? Or you're not any worse or dumber than your predecessors. Like, that's the kind of language that they use. Let me tell you, your childhood trauma issues, relationships that you've had with your father, everything's going to come to the fore. And if you don't address these things now, you're going to potentially crack. So you have to be aware that these are the harsh realities of what happens in medicine, not just standing up for yourself, but you stand up for your peers. That's the only way we can change this kind of ugly culture. So this is totally unnecessary on top of all those other stresses that we just talked about. So which brings me to thinking about failure. How do you define what is failure? So can someone say to me that basically you've passed all of your exams, you're now some successful consultant, you've got X, Y, and Z patients, but you've got a dysfunctional family life. Does that mean that you're successful? So what's success? What is failure? To an average person in society, that person might be a real idiot. You're the failure, because you failed to actually have a well-rounded life. You've had a fantastic, successful career, but you've actually failed at being a mother, or failed at being a partner, failed at being a friend, failed at being a child. What's failure? And failure is so arbitrary. The colleges each have different pass rates. Mine had like 80%. You had to achieve 80% to pass that exam. How is that successful? The university says it's 50%, your college says it's 80%. You know, so the whole thing is actually arbitrary. So how do you define success within yourself? How do you define failure within yourself? You've got to ask these questions. And ask yourselves, why did you choose to do medicine? What is it that you're trying to achieve? And it's a bloody hard thing to ask someone when they're like 17 and trying to get into university to define their whole career pathway. I mean, it's ridiculous. You're at a point where you're like, my head's here, my rear's here, and now I want to become a doctor. Like, that is actually ridiculous to expect a 17-year-old to choose a pathway that for me took 6 years. By the time I got there, I was like, oh, I've got to finish this. Oh, okay, so I have to do my internship to get my registration. Before I know it, it's 7 years. Okay, what now? Get into a training program. What do I get into? I don't know. I have to do an RMO year. There goes 8 years. I've tried everything I thought I would like. I didn't like it. I'm going to go for the hardest one. Oh, bugger. I'll probably need a PhD. Did a PhD. Then 10 years later, got myself onto a training program. Then add another 4 years onto that, really, to finish, and then another year on top of that for fellowship. 15 years later, you are at a stage where you have finally got your piece of paper. That's harsh. Where's your life gone? Have you achieved what you wanted to achieve by that stage, 35, 40? That's a bloody long time. I don't tell you this stuff when you're trying to get into medicine. So, what I'm going to show you actually is a video. And those of you who have seen it, please don't ruin it for each other. So, and then we'll have a chat about what you're watching. It doesn't need any volume, so did I just pause it again? So, of those who haven't actually seen this video before, how many of you missed the gorilla?
I've seen it.
So has everyone seen it? Okay.
Yeah.
That's fine. But I'm sure the first time you saw it, you did miss the gorilla.
I missed it this time too.
Oh, okay. The purpose of why I put that up is because I want you to think of that gorilla as medicine. Like, essentially what you're doing is you are so focused on where's the ball going, where's the ball going, you actually miss the whole bigger picture. You've missed what could be the obvious thing in life because you are so damn focused on your career. And I just want that to be a bit of food for you, for thought. Okay, so just I'm personally, I love mountaineering, it's my hobby, and I want you to just focus on that peak over there. And again, I'm doing this to illustrate exactly the same thing. If I keep saying to you, we're going to summit that mountain, and that is our goal, you have missed the beauty of the colours in all the leaves, you've missed that beautiful reflection, you've missed the people who are standing here, potentially the wildlife that's going on, the lovely cloud formations, because that's all you've done is focused on that summit. You've missed the bigger picture. And I want to plant this seed because I really want you to think about making sure that medicine doesn't take over your life. So what can you do? I'm a classic example. I did ophthalmology to the end, decided I didn't want to do it. I was so lost, I quit. Went overseas, took a year off, aimlessly went from country to country, hiked hundreds of kilometres across mountain ranges. For 4 times I went above 5,000 metres, trying to prove to myself that medicine's not important. To some extent I achieved my goals by doing that. The rest of society couldn't care less what your job is. That's the funny thing. We sit there and go, oh yeah, so what do you do? Oh, I'm a neurosurgeon, and what about you? Oh, I'm a pathologist. And we judge each other based on our subspecialties. To the rest of society, you're just a doctor. They don't care. They don't care what your subspecialty is. We make it important amongst each other, to ourselves. And again, we've missed the bigger picture because the rest of the world doesn't care. We've just made it so important. So keep your options open. What I did then was, what the hell do I want to do? And I was like, okay, advocacy was what I was passionate about, right? So I ended up getting out there. I got involved with the Third World Women's Shelter, helped them raise some money for their mountaineering group, and it felt amazing. I was an advocate outside of medicine. They couldn't care less that I was a doctor. I was still achieving the same thing, just in a different light. And I was fortunate enough that I had a PhD, so I was like, do I go academic? I can do that. But what do I do? What do I do with myself? What do I do with my life? There are options outside of clinical practice, and you need to keep that in your mind. You know, you can go into public health. You don't have to treat patients doing that. You can go into pharma. You can go into buy all sorts of medical devices. You can go into consulting. There's so many things you can do. Who said you had to clinically treat patients? And that's what I faced. It took me a year to then decide, okay, advocacy plus research plus still dealing with things in medicine for me means medical administration. It took me a while, but I did quit, hoping to find what I wanted to do. Knocked on every door, didn't get a job despite a PhD and a medical degree, overseas that is. Got nothing, zero interest until I came back home and decided I wanted to do medical admin. Have your life outside of medicine. Make sure you get a GP. You're not invincible. We're all human. Fortunately, you can't self-prescribe in Victoria. In South Australia, we couldn't. Let me tell you, we did it all the time. So just get help, debrief, talk to your friends, talk to your partner, have a life outside of medicine, keep in touch with the real world. Don't just surround yourself with medical friends, with medical partners, with everything in medicine. You will lose touch with reality if you do that. Self-awareness, as we talked before about the whole bullying and harassment and things like that, it is so important to be aware of yourself and those around you. Don't become a jerk-off doctor who then goes out there and goes, oh, she's just a nurse, she doesn't know what she's doing. That nurse will make your life hell, let me tell you. Not just that, but where's the aspect of being human? When did we stop caring about each other? You're not better than society. You're not better than people that you work with. Oh, she's just an administrator. That's really rubbish. That's a reflection of you and your thoughts, not a reflection of reality. And another thing I wanted to bring to your attention is that happiness is actually learned. And I don't have time to show you more TED Talks, but do put that into a search. Happiness is learned. And you will find people in the worst situations in life are actually happy. What is hilarious is you'll hear these stories, and I'm getting this out of these TED Talks, of someone's been in prison for 40 years for a crime they didn't commit, and they come out and they say, I wouldn't change a day in my life. Telling me they're genuinely happy? They are, because they've learned to be happy. Or they've sold paintings to people where they didn't have a choice, even though they wanted another one, and then they go back in a month's time and they go, oh, do you want those other paintings? Because they've come in stock now. And they're like, no, I'm pretty happy with the one that you gave me, actually. Because they learn to be happy. You can learn to be happy. Every emotion is actually a perception. It's what you perceive that's important. It doesn't matter that is reality. It's what's in here. And you can change what's in here for everything that you face in your life, because it's all just an experience. The other thing, being a doctor, that's fantastic, is look around you. As sad and awful as it is that your patients die, or that they get sick, or they have this horrible story, like I would hear these things or watch these things, people would die in front of me, and I'd be like, God, my life's actually pretty good. When you hear of the horrendous things that other people go through, you self-reflect and you're like, my life's actually pretty good. So I strongly advise you to do that with your patients. And the other thing that's fantastic about medicine is before you know it, you've been pulled from all sorts of areas. You have to rotate really quickly, get to know people really quickly, adapt your style really quickly, work under hideous, stressful conditions. What a great skill. to actually apply it in your personal life. You know, I don't know, you reach a point in a relationship where you're like, I don't like you anymore, so I'm going to cut you off, just like I cut my thoughts off when I leave the door of the hospital and I don't think about the patients when I go home. I'm now going to selectively apply it to my personal life. So these are skills which are priceless, which you are going to get through medicine, and it is such a unique area to develop these skills. You won't get it in most other professions. And I've written practice brain plasticity because it's the same thing. All you do is you become versatile in your life, in your head, in your thoughts. I've put up this picture because this is potentially you, this is your life, these are your friends, your colleagues, maybe your girlfriend, maybe your children, your parents. What is critically important in this is you. If you don't look after you, what's the purpose of all the other stuff? Or the impact that you're going to have on every other person in your life. So I strongly urge you, and I had to do this because I reached crumbling point with some of the bullying and harassment that I faced in surgery, and I had to go back and face my own childhood issues. Whatever works for you, I don't know. I mean, I read some great books like Louise Hay, she's fantastic, on You Can Heal Your Life, for example, that's a book, which made me then go back to why is this bothering me so much? Why am I so distressed by what's going on? Oh, shit, my father said whatever to me when I was a kid, and that's what I'm associating this with. So work on yourself, work on your fundamentals, work on why are you who you are, why do you potentially have the issues that you have, because until you do, you're not going to be able to face reality. And that's why I put up this picture of the tallest earthquake-proof building in Japan. It's like 76 stories high. And if your foundations are stuffed, you're not going to survive. So you have to address that. You have to address what is in here, what is in here. Because if you don't, you're going to crumble. I've just put this picture up because I've tried to sort of apply this in a context of what I'm familiar with, and that's mountaineering. As a mountaineer, it doesn't matter what weather you face. It could be sun, it could be hail, it could be rain, it could be shine. These are all my pictures of my adventures. And I've faced like 80 km/h winds, I've faced minus 45-degree temperatures, and if you are not taking the same breath, the same steps, you're not just as resilient as when the sun is shining, you're not going to survive. So I'm just putting it in context for me. You may be able to put it in context with something else for you. And finally, yeah, just wishing you all the best of luck on your journeys. And again, this is another happiness is learned. It doesn't matter what's happening, it's how you adapt to what's happening. That's important. Thank you.